Right now, as you're watching this video, pharmaceutical companies are making billions from medications that they've known for decades can destroy senior brains. This isn't conspiracy theory, it's documented fact. Internal company memos from the 1990s show they knew certain drug classes increased dementia risk by up to 50%, yet they continued aggressive marketing to seniors. Why? Because confused patients don't question their prescriptions. Every 66 seconds, another senior is diagnosed with dementia, but here's the terrifying truth. 1 in 3 cases may be completely preventable. The average senior takes 12 medications daily, and many are slowly shrinking memory centers by 28% within months. Let me prove this with Margaret's story. At 72, her family suspected Alzheimer's. She forgot grandchildren's names, got lost driving familiar routes. But instead of ordering expensive brain scans, I reviewed her medications. 4 different pills were poisoning her memory centers. 6 months after replacing them, Margaret rejoined her book club and started babysitting again. Today, I'll expose the 10 deadliest medications destroying senior minds and show you exactly how to protect yourself. Everything is reversible if caught in time, but you need to act now. Let's save your memory before it's too late. Number 10. Anti-nausea medications, also known as metoclopramide or Reglan. Robert, 68, was prescribed metoclopramide for persistent nausea and digestive issues. Within months, his wife noticed alarming changes: slower movements, rigid posture, and a mental fog that seemed to settle over him permanently. He'd stare blankly during conversations and struggle to find words that once came effortlessly. Here's the hidden danger. Metoclopramide blocks dopamine receptors throughout your entire nervous system, not just your stomach. Dopamine isn't just about mood, it's absolutely critical for both smooth movement and sharp thinking. When you block dopamine in the brain, you're essentially putting a brake on cognitive function and motor control simultaneously. Studies show seniors taking metoclopramide have a 35% increased risk of developing permanent movement disorders similar to Parkinson's disease. But what doctors rarely discuss is how this same dopamine blockade creates cognitive dulling that perfectly mimics early dementia. The solution? Domperidone works similarly, but doesn't cross the blood-brain barrier as easily, making it much safer for your brain. Natural alternatives like ginger, peppermint, or eating smaller, more frequent meals can often manage nausea without risking your mental clarity. Number 9. Diphenhydramine, commonly sold as Benadryl. Linda, a sharp 74-year-old retired nurse, started taking Benadryl every night to help her sleep. It seemed harmless. After all, it's over-the-counter and widely available. But within 6 months, her daughter noticed disturbing changes. Linda began missing important appointments, losing track of time during phone calls, and repeating the same stories multiple times in one conversation. Diphenhydramine is one of the most potent anticholinergic medications you can buy without a prescription. It works by blocking acetylcholine, a crucial brain chemical your hippocampus desperately needs to form new memories and stay alert. The older your brain gets, the more it relies on every bit of acetylcholine available. A landmark 2023 study found that seniors using anticholinergic drugs like Benadryl regularly had a 54% higher risk of developing dementia. That's more than half again the normal risk from a simple pink pill you can buy at any pharmacy. For allergies, switch to newer antihistamines like loratadine, sold as Claritin, which don't cross the blood-brain barrier. For sleep, consider melatonin or address the root causes through proper sleep hygiene. Never assume over-the-counter means brain-safe. Number 8. Proton pump inhibitors, also called PPIs. Helen took Nexium faithfully for 5 years to control severe acid reflux. The medication gave her immediate relief from painful heartburn, and her doctor assured her it was safe for long-term use. But slowly, Helen began struggling with word-finding difficulties and experienced a brain fog she couldn't shake. Blood tests revealed the culprit: severe vitamin B12 deficiency. Proton pump inhibitors like Nexium, Prilosec, and Prevacid work by dramatically reducing stomach acid production. While this stops heartburn, your stomach needs acid to absorb vitamin B12, magnesium, and other crucial brain nutrients. Without adequate B12, Your brain literally starts to starve. A comprehensive 2016 study in JAMA Neurology followed over 73,000 seniors and found that regular PPI users had a 44% increased risk of developing dementia. These medications also increase levels of amyloid beta plaques in the brain, the toxic proteins that drive Alzheimer's disease. The path forward requires gradual change. Work with your doctor to slowly taper off PPIs using H2 blockers like famotidine as a bridge medication. Deglycyrrhizinated licorice can naturally soothe stomach lining without cognitive harm. Remember, protecting your stomach shouldn't come at the cost of your mind. Number 7. Bladder control medications, such as oxybutynin. Frank's transformation from a sharp 73-year-old to someone who seemed lost in his own life happened gradually. His doctor prescribed oxybutynin, sold as Ditropan, for overactive bladder. The frequent bathroom trips were embarrassing, so Frank was grateful for any solution. Within months, Frank's wife noticed troubling changes, missed doctor appointments, losing his train of thought mid-sentence, and asking what day it was multiple times. Most alarming, he seemed confused about time and place, forgetting he'd already eaten dinner or asking the same questions repeatedly. Oxybutynin is particularly dangerous because it crosses the blood-brain barrier more easily than most bladder medications. While it blocks nerve signals causing bladder urgency, it also blocks the same acetylcholine signals your brain desperately needs for memory formation and clear thinking. A 2019 BMJ study followed thousands of seniors and found that those taking strong anticholinergics like oxybutynin for more than 1 year had a 49% higher risk of developing dementia. That's nearly 1 in 2, astronomical odds for treating a bladder issue. Fortunately, newer alternatives exist. Mirabegron, sold as Mirbatriq, works through a completely different mechanism without blocking acetylcholine. Bladder training exercises and pelvic floor therapy can also provide relief without cognitive risk. Number 6. Statin medications. Dr. James, a 65-year-old cardiologist, noticed something unsettling after starting atorvastatin for high cholesterol. He began forgetting patient names he'd known for years and would lose words mid-presentation during medical conferences. The irony wasn't lost on him. The medication protecting his heart seemed to be affecting his mind. Here's what most people don't understand. Your brain is nearly 60% fat, and cholesterol plays a crucial role in creating the myelin sheath, the protective coating around nerve fibers that allows electrical signals to travel efficiently. When you aggressively lower cholesterol, you may inadvertently starve your brain of essential building materials. A 2023 study in Frontiers in Aging Neuroscience followed seniors over 70 who had been on statins for more than 3 years. They had a 26% higher risk of mild cognitive impairment, and those on high doses showed even more noticeable declines in memory and processing speed. The solution isn't necessarily avoiding statins entirely, but choosing wisely. Pravastatin and rosuvastatin don't cross the blood-brain barrier as easily and appear less likely to cause cognitive problems. If you've been on statins for years and notice mental fog, discuss with your doctor whether a different approach might protect both your heart and mind. Number 5. Benzodiazepines. Patricia's family watched in horror as their vibrant 70-year-old mother slowly disappeared before their eyes. Prescribed Xanax for anxiety after her husband's death, the medication initially helped calm her grief-induced panic attacks. But over months, Patricia became emotionally flat, mentally sluggish, almost zombie-like. Benzodiazepines like Xanax, Valium, and Ativan work by enhancing GABA, the brain's primary calming neurotransmitter. While this reduces anxiety initially, long-term use creates chemical dependency that fundamentally alters brain function. The brain becomes sluggish, less adaptable, and increasingly dependent on the medication to feel normal. A landmark 2022 BMJ study followed over 8,000 seniors for 6 years and found that those who used benzodiazepines for more than 3 months had a 51% increased risk of developing Alzheimer's disease. The risk was even higher for long-acting benzos like Valium, which accumulate in brain tissue. What makes this particularly tragic is that many seniors become trapped. When they try to stop, withdrawal symptoms like severe anxiety and insomnia make the medication feel essential when it's actually the source of their cognitive decline. Recovery requires careful medical supervision. Gradual tapering over months, combined with alternatives like buspirone for anxiety or cognitive behavioral therapy, can help restore mental clarity once the chemical fog lifts. Number 4. Amitriptyline, sold under the brand name Elavil. Susan's journey into cognitive decline began with what seemed like a reasonable solution. Prescribed amitriptyline, sold as Elavil, for chronic nerve pain, she was told it would help her sleep better while managing discomfort. What she wasn't told was that she was taking one of the most potent anticholinergic medications still in widespread use. Within a year, Susan's husband noticed she was struggling with word finding in ways that seemed beyond normal aging. She'd pause mid-sentence, searching for words that used to come effortlessly. Simple tasks like following recipes became mysteriously difficult, and her once sharp wit became clouded with confusion. Amitriptyline blocks acetylcholine so powerfully that cognitive effects aren't just possible. They're virtually guaranteed with long-term use. This medication was developed in the 1960s when our understanding of brain chemistry was primitive. Today, we know it's like using a sledgehammer when a scalpel would suffice. A massive 2015 study in JAMA Internal Medicine followed over 3,400 seniors for 10 years. Those taking higher cumulative doses of anticholinergics, like amitriptyline, had a 54% greater chance of developing dementia. The damage often happens silently, mistaken for normal aging until it's advanced. The tragedy is that safer alternatives exist. For nerve pain, duloxetine or gabapentin provide relief without anticholinergic burden. For depression, newer antidepressants like sertraline are generally safer for aging brains. Number 3. Paroxetine, commonly known as Paxil. Michael's descent into mental fog began when his doctor prescribed paroxetine, commonly known as Paxil, for depression following retirement. At 72, Michael had always been intellectually sharp, an engineer who solved complex problems with ease. But within months of starting Paxil, his wife noticed disturbing changes in his mental clarity and focus. The man who once designed intricate mechanical systems began struggling with simple crossword puzzles. He'd start conversations and lose his train of thought mid-sentence. Most troubling, his emotional regulation seemed off, not just depression, but a strange disconnect from his own thoughts and feelings. Here's what makes paroxetine uniquely dangerous among antidepressants. It's the only SRI with significant anticholinergic properties. While other antidepressants like sertraline or escitalopram work primarily on serotonin systems, paroxetine also blocks acetylcholine, the same brain chemical disrupted by all the dangerous medications we've discussed. A comprehensive 2021 review in Frontiers in Psychiatry found that paroxetine users showed measurable declines in short-term memory, verbal recall, and attention span within 12 months. Seniors on paroxetine were 30% more likely to show early cognitive impairment compared to those on other antidepressants. The solution is straightforward: avoid paroxetine entirely in seniors. The American Geriatric Society has placed it on their Beers criteria list of inappropriate medications for older adults. Safer alternatives like sertraline or escitalopram provide effective depression treatment without cognitive risks. Number 2. Antipsychotic medications. Thomas's story represents one of the most heartbreaking trends in modern healthcare. At 81, this former high school principal was admitted to a nursing home after a mild stroke. Initially cheerful and engaging with staff, Thomas gradually became withdrawn, emotionally flat, and mentally absent. His family watched helplessly as their father's personality seemed to disappear. What they didn't know was that Thomas had been prescribed quetiapine, sold as Seroquel, not for schizophrenia or bipolar disorder, its intended uses, but simply because he was occasionally restless at night and asked too many questions during shift changes. This represents a tragic misuse of powerful psychiatric medications as chemical restraints for staff convenience. Antipsychotics like Seroquel, Risperdal, and Zyprexa work by suppressing dopamine throughout the brain. While this can calm agitation, it devastates the dopamine pathways essential for motivation, personality, and cognitive function. Seniors on these medications often appear sedated, emotionally empty, or zombified, their essential humanity chemically suppressed. A 2022 study in Lancet, Healthy Longevity, found that seniors prescribed antipsychotics for behavioral symptoms were 71% more likely to develop worsening cognitive decline within 12 months. These medications also dramatically increase risks of stroke, falls, and sudden death. The solution requires advocacy. Ask hard questions about why these medications are prescribed. Often, behavioral symptoms can be managed through environmental modifications, structured routines, and improved sleep hygiene, approaches that restore dignity rather than chemical suppression. Number 1. Anticholinergic polypharmacy. Dorothy's transformation from an active 78-year-old community volunteer to a confused, dependent woman didn't happen from one obviously dangerous pill. Instead, it was the slow, insidious result of what we call anticholinergic polypharmacy, the most dangerous and under-recognized threat to senior brain health. Dorothy wasn't taking one harmful medication. She was on 8 different prescriptions: diphenhydramine for sleep, oxybutynin for bladder control, amitriptyline for nerve pain, paroxetine for mood, and several others. Each one alone might cause mild memory problems, but together they created a perfect storm of cognitive destruction. When you block acetylcholine from multiple angles simultaneously, your brain doesn't just slow down, it begins to decay. Neurons wither from underuse, synapses shrink, and the brain enters a state that perfectly mirrors Alzheimer's disease. A 2022 analysis in Age and Aging tracked over 280,000 older adults and found that those with the highest anticholinergic burden had a 120% increased risk of developing dementia within 10 years. That's more than double the normal risk. Here's the empowering truth. Drug-induced cognitive decline is often reversible when the burden is lifted through careful medication review and safer alternatives. Many seniors regain clarity, energy, and memory function within weeks or months. This makes polypharmacy the #1 preventable cause of senior cognitive decline. Now that you understand the risks, let's turn knowledge into action with a simple 5-minute assessment that could save your mind. First, gather every medication in your house: prescription bottles, over-the-counter pills, supplements, even that sleep aid you only use occasionally. Create a complete list with generic name, brand name, dose, and frequency. Watch for these 7 warning signs: sudden word-finding difficulties, confusion about time or place, trouble with familiar routines, personality changes like irritability or withdrawal, difficulty concentrating on tasks you used to enjoy, forgetting recent conversations, and feeling mentally foggy. Calculate your anticholinergic burden using free online tools like the Anticholinergic Cognitive Burden Scale. A score of 0 to 2 is safe, 3 to 5 indicates moderate risk, and above 6 puts you in the danger zone, requiring immediate attention. Walking into a doctor's office prepared makes all the difference. Start every medication discussion with these golden questions. What is the anticholinergic burden of this medication? Are there safer alternatives? What's the minimum effective dose? And how will we monitor for cognitive side effects? When expressing concerns, frame it professionally. I'm worried about how this medication might affect my cognitive function. I'd like to discuss safer alternatives. Make specific requests. Ask your doctor to review your complete medication list for anticholinergic burden, request lower dose trials, and inquire about non-medication alternatives. Bring documentation to every appointment: your medication list, symptom notes, and specific questions. Request that cognitive concerns be noted in your medical record for accountability. If you're caring for someone with potential medication-induced cognitive decline, keep a tracking journal noting medications taken, behavioral changes, and mood shifts. Patterns often emerge that doctors miss during brief appointments. Recognize emergency signs requiring immediate attention: sudden severe confusion, hallucinations, extreme agitation, or dangerous behaviors like leaving stove burners on. When loved ones resist medication changes, approach with empathy. I've noticed you seem more confused lately. Let's ask the doctor about your medications. Remember, medication-induced cognitive decline is often reversible when identified and addressed promptly. Your advocacy could literally save their mind. Here's what I want you to remember. The brain has remarkable recovery capabilities. I've witnessed patients regain sharp memory and renewed energy within 3 to 6 months of addressing medication-induced cognitive decline. Margaret's story isn't unique. It's achievable for many suffering in silence right now. Unlike true dementia, medication-induced cognitive decline is often completely reversible when caught early. You have more control over your brain health than you've been led to believe. Don't wait another day. Check your medicine cabinet tonight. Create that medication list and calculate your anticholinergic burden using the tools I mentioned. Schedule an appointment with your doctor this week. Bring your medication list and those golden questions we covered. Share this information with family members who might be struggling silently. Subscribe for more brain-protective health strategies, and remember, knowledge without action is powerless, but informed action can literally save your memory.